Hello everyone, welcome back to our channel. In today's video, we are diving deep into OET speaking section and focusing on role plays. Specifically, I'm going to walk you through some optometry and dentistry speaking samples. I'm going to show you exactly how to approach them, and I will share some tips on how to score high in these tasks. Whether you're a healthcare professional and preparing for the OET or just curious about the test, this is the perfect guide for you. Let's get started. When we say about OET speaking section structure, here you will face two role play tasks. Each task lasts for around 5 minutes, and in each, you will take the role of a healthcare professional and you will be interacting with a patient or sometimes a colleague too. These role plays are where your communication skills are put to the test, and the goal is to demonstrate clear, effective, and empathetic communication in a medical setting. Before we jump into examples, it's very important to understand the linguistic criteria. Pronunciation, that's the first and the foremost thing in linguistic criteria. So you need to speak clearly. You want to ensure that every word is understandable. It's not just about speaking fast, it's about speaking clearly and accurately. And the next one is fluency. Try to avoid unnecessary pauses or hesitation because a smooth, confident delivery goes a long way in this task. But if you do stumble, just don't worry, keep going. And the third one is grammar and vocabulary. So please make sure your sentences are grammatically correct because it's important to use medical vocabulary, but it needs to be used appropriately too. This means that you should not overcomplicate things. Just try to keep it simple and clear. And I'm going to give you some tips for scoring high in OET speaking. So grab your pen and paper, just take a note of it. The very important tip is stay calm and focused. Think of this as real life conversation. Like you are a healthcare professional, so speak like one and don't rush. Speak at a steady pace. Speaking too fast might make it hard for the examiner to understand what you are speaking. And try to use clear instructions and explain simply. Whether if it's a treatment plan or medical advice, make sure to break the things down in easy to understand language. Remember, your goal is all about clarity and try to be empathetic and professional, especially in patient interaction. Like showing empathy is the key, right? For example, when you're explaining a diagnosis, make sure to show understanding and try to address the patient concerns as much as possible. Let's break it down with a role play in optometry. Here is a scenario. Imagine you're an optometrist now, explaining the results of an eye exam to a patient who was concerned about blurry vision. And you need to explain the diagnosis and give the patient advice. Now let's break this into step-by-step approach. Always start with a greeting, like, "Good afternoon, Mrs. Smith. How are you feeling today?" Give context to the situations. Say, for example, "I have reviewed your eye exam results and it looks like you are dealing with a mild case of nearsightedness, which is myopia." And try to explain the diagnosis in simple terms. Myopia means like objects far away or a bit blurry for you, but you can see things up close clearly. It's a very common condition, and we can easily correct it with glasses or contact lenses. And now the next one is you should provide recommendations. What would be your suggestions or recommendations? You can say, like, "I would recommend a pair of glasses to start with. We can choose the right lenses for you and ensure that they fit comfortably, and try to address any patient concerns." I understand this might be a little worrying, but myopia is very treatable and we will make sure to find the best solution for you. and try to wrap up with a perfect closure. You can ask like, do you have any questions? Or would you like to explore glasses options further? Got it? So when it comes to linguistic communication in this example, the words nearsightedness, myopia should be pronounced clearly. Speak slowly and give the patient time to understand. Notice that the conversation flows in a steady manner, no awkward pauses or rushing. Simple professional vocabulary is used in this example to explain the medical condition, right? So try not to overcomplicate the explanation, which is very, very important for clear communication. Now let's look at a dentistry scenario. Here you're a dentist explaining the need for a dental cleaning and discussing cavity treatment options with a patient who is anxious about dental procedures. So always start with empathy, like, hello, Mr. Johnson. I see you are a bit nervous about your appointment today. How are you feeling? And then try to explain the situation. I have reviewed your x rays and noticed a few areas where plaque has built up, which can lead to cavities. It's important we can clean those areas to prevent further damage. And try to give assurance to the patient, like the cleaning process is simple and prevents future issues. We will make sure you're comfortable throughout the procedure. Then try to offer treatment options. For cavities, we can use fillings or crowns based on severity. I can explain both options in detail if you would like. The next one is try to address patient anxiety or any concerns. I will guide you through each step to ensure comfort. You will be in good hands. And conclude with further steps or what are the next steps that the patient needs to take. Like, would you like to schedule the cleaning process or can we discuss further? So, these are the best examples for a role play when it comes to optometry and dentistry. I'll have some final thoughts for you. When it comes to linguistic criteria, it is a big deal in OET speaking section. So make sure your pronunciation is clear, fluency is smooth, and your vocabulary is accurate and appropriate. For both optometry and dentistry, your role plays should sound natural, empathetic, and professional. Always break down medical information in a very easy to understand way and make sure the patient or colleague feels comfortable and informed. And I have an interactive tip for you. After you finish watching this video, grab a pen and paper and try out these role plays on your own. Practice saying the sentence out loud and imagine you are in the exam. And you have to ask yourself, is my pronunciation clear? Am I speaking at a steady pace? If you're unsure about any words, look them up, practice, and keep going because self reflection is very important, right? That's all for today. I hope this breakdown of OET speaking, role play for optometry, and dentistry helps you get ready to ace the test. Let me know in the comments if you have got any questions or need more examples. Don't forget to like, subscribe, and hit the bell icon for more OET tips. Best of luck, and I'll see you in the next video. Bye bye.